This is Carrie. When you mentioned doing a calibration in between treatments, so if you have the same person and you're doing say you're in the allergy panel and you run a treatment and then you want to focus in some areas that didn't get to 75 and you maybe move either to the comprehensive one above it or the one below it, do you calibrate in between those that are kind of technically within the same?
No, just once per session. If you go to different panels, the calibration is just for the particular session.
And if you go between neuro, emotional, and spinal, were they linked to each other? Would you calibrate in between there or not where they link over?
No. You would want to probably calibrate again. Let's say you do a treatment in the morning and then you do a treatment, and then you disconnect completely and do another treatment later in the afternoon or in the evening, then you probably want to calibrate again. But in one session, even if you do 2-3 panels, you don't need to calibrate again. It's just once per session. It's a baseline that between the computer and the body, so the mathematical calculations can happen. So now, as far as using different panels is concerned, okay, so the main reactivity panels you really should only do once in 24 hours. So that's the Allergen panel here. Okay, you only want to do that once in 24 hours and then leave it alone, because it takes the body 24 hours to implement the changes into all 100 trillion cells. And the other panel where you want to do that is that reactivity test here, the so-called main reactivity test, which is 7,000 items, while the Allergen panel is about 2,500. So it is larger, more than twice as large. I don't recommend starting out with that. I usually start out with the Allergen panel, but you have more, more information here. Once you hit the plateau or something with the allergen profile, you can come here. So we'll come back here, and this is how you get out. I mean, you can go back out the program to the navigation page here, but if you just want to get back to the navigation page, this is how you get here.
Can I ask you a question, Dr. Straley? This is Maggie. Yes. I'm curious, sometimes when I will check something on the allergen panel and then check it on the reactivity test, for example, COVID, because I have a lot of people that are coming down with COVID right now and are asking me to treat them. And I'll check the allergen panel, and the COVID-L and COVID-S values will be one thing, and then if I check it on the reactivity test, they'll be different.
Oh, COVID is actually on here. Okay, well, that's good. Yeah, you can't do that. I mean, you're just trying, I mean, why would you do that? That's the thing. It doesn't make any sense, to cross-check. It's because it's the same thing if you check single item and, you do it here and then you do it on the other panel, you're going to get slightly different numbers. I mean, then it gets very sophisticated and it's just confusing and there's no value in it.
Is one more accurate than the other? Or like if I'm going to treat somebody for COVID, is it better to do it through the reactivity one or better to do it through the allergen? Or
no, it basically depends on the details. Your best, the best. So by the way, the way to, like, if you're looking for a frequency, since we're talking, Maggie's talking about COVID, let's just, I don't have a problem with the word COVID. I mean, for God's sake, we live in America. I don't think we have to worry about what we talk about. I mean, so here you can put in, let's say, this. Well, this S is the spike protein, and L is some other component of the. It's somehow related to the vaccine. Otherwise, it's you're looking at the coronavirus.
That one I only found on the reactivity test one too, I think.
No, it's here.
Is it?
Yeah.
Oh, okay, so good.
Here's SARS, and here's coronavirus, Italy, and Wuhan, right? So the advantage of working in this panel is that you have these additional feedbacks in the center. Okay, which I so for example, you could do I mean, there's a lot to talk about. So I treat people even if they are not acute. So if you treat somebody with these frequencies and these additional feedbacks, you're basically giving them a modern day vaccine, the way we should be working, you know, not with chemicals and injections and jabs and stuff, but energetically to give the immune system a heads up. But when you do that, what you want to do is you want to activate the quick cycle, okay? So what that does is it will then run through these items here and then cycle through these items here. So BBF stands for brain body function. It's really MBB, like it's still BBF here too. So BBF is still the way that NAET called them, body brain function. The same frequency in the future, or some people already have it, like on your ASR biofeedback. It's called MBB, which stands for mind body balance. Same frequency. It's an emotional frequency. It's to prepare the body for these rather intimate and treatments, you know. Working on somebody's DNA is about as close as you can get. So acid basically covers digestive acids, base covers digestive enzymes, and then DNA is just an energetic vector generally to the DNA, and RNA is the same, the general vector to the RNA component of the DNA. Hypothalamus is the autonomic nervous system, then all your organs. And unless a woman is pregnant, I wouldn't put the hormones in. I would leave them alone during that period of time. And certain times, and you know, you just want to be a little bit more conservative with hormones. But you put all these in, and then you can cycle through. You can do that on this panel. On the main reactivity, you can't do that. Okay, you don't have a quick cycle, and you don't have combinations, but you have other advantages. For example, you can combine, you know, let's say we put COVID in, so now you can combine it with some acupuncture points that you can do on the Allergen Panel. Okay, so what I do, so generally speaking, so there's all kinds of options. So it all depends on if this is the first 10 treatments for a person, or if this is treatment number 50. If this is treatment number 50, you know, you can come to this reactivity test. But I would advise as much as possible to take care of the basics, because otherwise you're going to run around. I mean, you're going to chase the symptoms, you know. So in order to assess a person, there's a couple different ways. Of course, there's the Chakra Panel, which is balancing the organs. You could do that. I'm going to use the Meridian Panel to assess Pamela right now. So over here, you have 360 basic acupuncture points, okay? All 360 basic acupuncture points. That's the test potential right there. Okay, but what I'm going to do now is I'm going to do, because I want a more general assessment of the energy situation of Pamela. So I'm going to measure the meridian, and what that does is it gives me okay. So there will be a color coordination or color coding, as you know. The top, you know, red is the top number, red, yellow, blue are the top three, and then the bottom number is green. And the default feedback would be those color-coded top ones. But often, but the entire program is set up to achieve balance, you know. You will find that it's one thing that the IMAET teaches here is that balance is what we want. We don't want extreme highs and we don't want extreme lows. So for example, point in Pamela's case, the liver is at 76, right? So these numbers go from 0 to 100. So 100 would be is the highest number, would be extreme heat, inflammation, heat. Both extremes are kind of reflect congestion, but just too much energy, okay? But it's 24 points away from 100 from the super extreme, while this lowest number here, stomach meridian at 4, is only 4 points away from 0. So the low number is much more extreme, okay, and probably needs more attention much more urgently than the liver meridian. So I would override that and I would work on a stomach meridian. So the single digits are stomach and heart. So for right now, we'll just focus on those. So I'm going to override the default here and go for the low numbers. And what that means is we're going to be pumping energy into, let's say, into Pamela's stomach meridian. We're going to flush it out, remove the blockages. So low means more dampness and low energy and exhaustion and lack of chi and so on and so forth. What we're achieving with this treatment, and it's good to do that in preparation for a treatment, because remember, we are using these meridians as a communication highway, to the cells and the DNA within. If you're working with the harness, okay. If you're not working with the harness, okay, we're working with the body biofield, which represents the same energy flow, just in the body field rather than in the meridians. Of course, then that analogy doesn't quite work. Nevertheless, okay, stomach. So it rectified 3%. So what does that tell us? Well, I only did 1 minute. Okay, usually you would want to do these kind of treatments are usually 20 minutes. Even though. So anyway, 3 minutes just tells me that this is a pretty serious situation. So let's do another minute. See if we can pump up Pamela a little bit.
Can I ask a question?
Yes,
Again?
please.
Sorry, this is Maggie again. Do you ever set the time to 0 and then let it run? Because then it will just run through and do the percent.
No, if you put the timer to 0, it will run until somebody turns the thing off.
Mm-hmm.
So it's a little dangerous. Maybe in this situation on this particular panel, I don't think you can do a lot of damage. But other panels, you don't want to necessarily do that. So the timer goes, the highest that the timer will go is 30 minutes. And there's a reason for that, because that's a big treatment. That's a long treatment. So remember, usually we're instructing the body to do something. So you don't want to stress the body too much, because then it's counterproductive. So the second run, we're still only up to 16. Okay, so you can see that this lack of stomach energy is pretty serious.
Could you speak to something you just said, Dr. Strahl? You mentioned the body biofield versus the harness and metaspace. Can you just explain? I know some of this can be done virtually, but I don't really fully understand it. And I have one client that would probably be helpful with that's in another state from me. So could you just maybe speak to that? I know you mentioned it, but whenever it makes sense to kind of explain that, I'm very curious.
Okay. Well, here's the thing. The reality is that wherever there's energy flow, there is a perpendicular electromagnetic field around it. No matter what, and it's not even energy, wherever there is flow of anything. So if you have a water artery going underneath your house, there will be an electromagnetic field radiating into the house, which can be damaging. For example, you don't want to have your bed right over the electromagnetic field of a water artery or some kind of water running underneath your house in the ground. But we're very familiar with electricity. Wherever there's electricity, there's a perpendicular field around it. So this energy that runs in the meridians in the body is very intense. It's a lot of energy. It's not just a little bit. And it generates an electromagnetic field around it that's at least, it can be measured out to 6 feet average, okay, on the average individual. So with the metaspace or the virtuoso, we are intersecting not directly with the meridians like with the harness system, but we're intersecting with the biofield, which contains exactly the same information and allows us to do the same thing with a different, it's just a different technique. That's the beauty about, and then actually that biofield, connects us further to whatever, the world, actually the universe. But so, okay, 78, we'll say that's good. Let's see how low the heart is here. We'll pump a little energy into the heart. So this is just an incredibly nice or good and useful panel, the meridian profile, or the traditional Chinese medicine type, the
So you want to do the green ones and not the red ones?
Well, it depends. Now, in Pam's case, yes, because her low numbers are more severe than her high. Remember, her highest number was 76. Now, if
Okay,
her
I
high
get it.
number was going to be 96, we would have done that as well, because that would be just as important. But 76 is less severe than 4, you know? 76 is 24 points away
Okay.
from 100, which is...
So it doesn't matter the number about the rectification? You should never do it more than 30 minutes?
Yeah. If you can't achieve balance in 30 minutes, then that means you have to come back later, either later that day or some other day, the next day. Or,
Okay.
you have to
I've been
repeat.
trying to get it up to 98, so I was running it multiple times to get it up to that number.
Well, that's okay. What you may want to try is, so the body responds better to pulsating things than to steady. It's just another survival mechanism because the body has to deal with so many signals that are bombarding it. So it's constantly sorting out, should I block and ignore this particular frequency, or should I absorb it and deal with it and process it, okay? So after a while, it will just try to ignore it. So you're better off. So what I do when I treat certain people, including especially myself, then I would do the heart for a few minutes, and then I would do the stomach for a few minutes, and then I would go back to the heart, and that way you will find that harmonization percentage here grows faster. It grows faster than if you just keep doing it steady for 30 minutes.
Well, I do have a heart problem. I've had open heart surgery, so that heart makes sense.
Okay, yeah. So these are not necessarily anatomical relations, but functional. But nevertheless, yes.
What is the triple warmer? What is that? I've never heard of that.
Triple warmer is the endocrine system. There's explanations coming for these meridians. They're coming. I don't know whether it'll be any upgrade in March. We're running out of time. We'll have to see. There's still a couple weeks window. Okay, all right. Very important panel. Remember that one. It's
So when you're doing someone for the first time, you should go to that one?
It's like going to the acupuncturist, okay? It stands all on its own. It's a treatment all by itself. Even so, I'm using it right now in combination, in preparation for a show method treatment is what I'm going to show you. But getting into actually changing part of the epigenetics of a person. So then, now I would go to the Allergen Panel. Okay. So, okay. Now listen, when you get started with yourself or with somebody else, you don't even have to run a scan. You could just, if you've never done, I highly recommend to keep track of what you've treated. Because, if you, let's say, have to treat yourself for eggs more than once, 2, 3, 4 times, you know that this is a serious problem, and you may want to be aware of that. So you can figure out which component of the egg is the difficult one. Usually eggs is, it's the protein part of the egg. But these are all basic items that everybody has problems with. Okay, this is how our metabolism functions and operates. There is no genes for meat. There's even genes for egg. What egg represents is basic protein digestion. There's no gene for peanut butter. There's no gene for spaghetti sauce. But there are genes for all the different sugars. Now if you click on sugar, this is not. There's all kinds of sugars here: cane sugar, beet sugar, brown sugar, corn sugar, rice sugar, maple sugar. And for those items, there are genes responsible for their metabolism. So that's why these are the things that we want to treat. There's quite a few people out there that have iron dysmetabolism, not just hemochromatosis, but all kinds of problems. Just inflammation is caused by iron dysfunction. But for Pam right now, so I'm gonna just jump. So don't be afraid to start out And I don't mean because you are a beginner, but with a new person that's getting these treatments, because you want to straighten out the metabolism first, because otherwise everything depends on a metabolism functioning right. And you can't assume that it is, because it isn't. Everybody has mutations in it. It's just some people have more or worse ones than others. But you know, vitamin D and vitamin E and vitamin C, and of course the B vitamins. But on PAM right now, I am going to do the comprehensive one, which is the 2,500 items.
So how many of these different food ones can you address in a day?
Okay, so what you want to do is you want to start thinking about layers. So you address one layer in a 24-hour period. So for example, and it depends on which stage of the treatment procedures or the treatments you are in. Okay, so for example, I recommend to do the B vitamin complex first, you know, and which covers about 24 different B vitamins. And then, you know, later down the road, you realize, oh, there's a particular problem with vitamin B6, there's a particular problem with vitamin B3, and then you revisit those single ones later. So for example, those sugars, right? Well, that's one layer. So first you just you do all the sugars together, and then you know, later down the road you realize that there's a particular sugar that has a more serious problem being metabolized. Or you do a group of bacteria or a group of viruses, and you'll notice that it's certain people have more trouble with viruses or a predisposition, you know. Other people are more predisposition for parasites and so on. And rather than mixing it all together, so what I'd like you to learn and to become aware of is to be precise. The more precise you can do a treatment, the more effective it's going to be. If you put everything in one basket, then it's just still confusing, you know. You want to focus the body on something. Now, what you can do is you can do treatments every day. If you do 365 treatments a year, you're going to totally that body is going to be tuned to perfection, right? But if you do 365 things in one day, all you're going to cause is trouble. It's too much. It's just going to be even more chaos because the body is totally confused about what you're trying to do. So to stay within.
So can you do emotional ones?
With emotions, that's a whole nother topic. There's different levels of problems, you know, of emotional trauma. Some is just, so as far as this panel is concerned, there's emotions in this panel, and you'll see them, and they're extremely accurate. And however, you have to realize also that emotions are normal. People have emotions. My last patient last night was the number one was fear, number one at the very top. And so I asked her, you know, I said, what are you afraid of? And yeah, she was afraid of a lot of things, COVID and the stock market crashing and all these kinds of things. I said, don't worry so much. And you know, that even so it was at the top of the result here, it did not have to be treated. I mean, I muscle tested her, and that emotion, it was there. It wasn't interfering with anything, even though I'm sure it kind of does in the long run. But for that session yesterday, there were more important things to take care of than, because she just kind of got started. It was maybe treatment number 5 or 4. So there's lots of issues. However, there's some emotional trauma that is damaging or interfering with function. And those you have to treat separately, and sometimes you can just put an emotion in with the treatment, with a metabolic treatment. All right, so here is Pam's result. Okay, so just so you know how the software is organized. So if you do a feedback now, like if I do a feedback now, the software will automatically do the top 3, the color-coded ones. Ovary tissue, bacteria 44, and immunoglobulin M. Okay. And then the second thing is you could add some, which I highly recommend to always do, not just sometimes, but pretty much always, except when you do if you just do emotion, which you usually would do in the emotional panel, and activate that quick cycle, even if you do the default. But you could say, by the way, these numbers over here, they have nothing to do with anything. They are the ID number of, so there's 2,557 or something items in the database, and it just happens to be where they are listed in the list. Okay, so blackberry liquor happens to be the 1,764th item on that list. What you actually
What
want
is
to look.
pressed wood?
Pressed wood is pressed wood, like a particle board and stuff like that. So it's in furniture, it's everywhere. It's in flooring. It's our buildings are made
That
out of.
keeps coming up for me, but I don't know how to avoid it.
So, well, you can't necessarily avoid it, but you have to desensitize yourself to it. So this is basically a chemical. They gas off. Okay.
Right,
So,
and I have multiple chemical sensitivity, so I don't get anything new. All my stuff is old.
okay. So you can override this and do pressed wood, right? And as a single item and all of these. Or more often than not, what I do is I right click here, put your pointer in here, right click, and now you have, you can put this custom treatment basket thing here together. Okay, so, okay, I always pay attention to infections. I mean, why would you not pay attention to infections? I mean, you could say, okay, well, I have all these infections, but I'm not going to worry about that. Well, it's a problem. I mean, you do want to worry about infections. So in Pamela's case, of course, we got a little bit of everything. We got a bacteria, we got a parasite, we got a virus. I think this is a mold, Curvularia specifera. So some of these things are functional and just give you feedback, and some of these things are a problem. So for example, cortisol, it just tells me that her stress hormone levels are kind of high. But I mean, it's afternoon, so yeah. Mold antigens tells me that there's some mold stuff going on. So we're looking for layers. We know that Pamela is sensitive to chemicals, so that's pressed wood. So now we're looking for other chemicals. Is there other chemicals, or is this the only one? So really, I don't go much further than this. Maybe a few more. And there is no other chemicals. There's soybeans, that's important. It's really the first food that comes up is soybeans, which is amazing. Collagen, isolation. So that's caffeine. So what's your relationship with coffee? So that would be a detox thing. And here is.
I don't drink coffee and I don't eat caffeine because of my heart problem.
So you may be sensitive to. Did I really go down that far? Okay, so egg white. Okay, so I like to always put in a food item for the basic, to cover the basics. So egg white is about as basic as it comes. That's basic protein. So let's pay attention to protein digestion, because if you can't digest your proteins properly, then your detoxification system can't function either. And then, so this ovary tissue here, what does it mean? You can always kind of get an idea of what it means.
Menopause?
By by highlighting it and do a test single item, just to see whether it comes in really high or really low, but it's not. 46 is kind of almost balanced at 50. So that means, okay, we're not going to pay attention to this ovary tissue, at least not in this session. But let's pay attention to this bacteria. Let's put it in. Immunoglobulin M is too fancy. It's not something we want to particularly put into a treatment. We could put in. So now we have to decide. are we gonna work on a detoxification issue or not? So maybe we will. Since you give us this feedback, let's put in pressed wood. You have clips, surgical clips, or any metal in your body?
Yes, I have stainless steel wires holding my chest together.
Okay. That may be a problem. You may be actually sensitive to that steel. So let's put that in. It's not necessarily better to put in a little more. It's most important to put in to have a precise kind of treatment. And then, as I said, you can always do another treatment tomorrow. And we would put all these in, just put them in routinely. And I'm going to put hormones in too, because cortisol is a hormone and it's out of balance towards the top. So usually you would do 20 minutes, okay? Right here, 20 minutes. Right now, I'm just going to do a couple minutes just to get an impression here. And the quick cycle is already. I saved this here. Did I? Yeah. Okay, and off we go. So there's a treatment. Now we have 1, 2, 3, 4 items in here, and we got 1, 2, 3, 4, 5, 6, 7, 8. So we got 12 items in this feedback. So that's a lot. That's a lot. But I look at these here in the middle as kind of vectors to focus this treatment to where we actually want it to go. We want to address digestion, of course. We want to send this information towards the DNA and the nervous system. And of course, the organs are the powerhouses that work the body and everything. So that's why these. So now instead of running, let's say we had 20 minutes in there, it would treat these 4 items for 20 minutes. It would do 5 minutes on each of these. If you don't activate the quick cycle, it would do 5 minutes on each of these, and then at the very end, it would do the additional feedback. But what it's going to do now, because we activated the quick cycle, it's going to do these for 1 minute, and then it's going to do those. And then it's going to cycle back and do these for another minute, and it's going to keep cycling. And it makes treatment more effective and more permanent and deeper. So we have, let's say, at least 3, maybe 4 components in this treatment. We're talking to the immune system about this bacteria. We're working on the detoxification apparatus about pressed wood and possibly steel, even so steel is just more of a sensitivity kind of thing. You can't really detox steel, however, you want the body not to react to that. So is your chest still kind of sore always?
Oh, well, I have my scar, and then I got skin cancer on top of my open heart surgery scar, so my chest is a mess.
So you see how this is actually hugely important? I mean, that doesn't make any sense. I mean, why would you have cancer? Obviously, something is driving that, and it could very well be that. So the surgical steel rectified at 98%, that's not bad. So you see, you have to look at these results in context with the person you're working on, because that will help you to make the right decisions. And then don't stress out about, oh my God, did I make the wrong decision? I mean, the thing is doing these things frequently, often, because if you didn't get it right, if you get it perfect this time, well, then you'll get the rest of it next time, and that's just how it works. There's so many things, we all have thousands of mutations in our DNA, thousands, or I should probably say thousands of disadvantage type of mutations. Okay, there's sometimes a mutation that puts you at an advantage because it makes a gene function higher than average. Okay, but for the most part, these mutations are negative usually.
Can I ask you a question, Dr. Straley?
Yeah.
If you've started a basket on somebody and you're metaspacing them on the quick cycle, and then you're like, oh, whoops, I forgot to add the additional feedback. Does it cause a type of problem if I just press stop feedback and then add that?
Yeah, you stop the feedback and you put let's put the vitamin B12 in there. and you keep going. The only thing is to start over again as far as the timer is concerned.
If there is something that maybe you would think is a negative, like let's say COVID, and you run it on somebody and it comes up a 4, would you still metaspace? Would you still treat them for that, or would you say, okay, that's great, their COVID is super low?
Yeah, in that case, I would probably drop the COVID. I would, I'm still learning too, and I've yet to expand my consciousness to the place where I say a low virus still needs to go into treatment because it's low.
Right.
But that's a little far-fetched. Even so, I have learned over the last couple of years that viruses do have a purpose. They're part of our evolution. Yeah, considering at the moment, the hysteria and the problem with COVID, I would skip it. It's obviously not very important.
And then, like, I have somebody that is diagnosed, they have Lyme. And then I ran it on them, Lyme on them, and it came up a 4. And I was like, okay, I would have expected it to be like a 99 or something really, really high. So then I know that, you also want to pay attention to the very low lows, but in situations where I don't want to switch on Lyme for her, like maybe it's under control. So I'm just curious what you do in that situation.
Well, what will happen over time is you will totally lose confidence into the medical system and its diagnosis. You know how many people I have treated that had been told or had a test result or that they had Lyme, and they did not have Lyme. They had all kinds of other infections, but not Lyme. And other people that had no clue they had Lyme, they had Lyme. So I trust the IMAET a lot more than the medical system to come up with their diagnosis because it's very flawed. So the best thing you can do is follow, and this is the panel to use for these kinds of things, the allergen profile, and treat whatever, talk to the immune system, what comes up here. Now, what you do want to do is, so let's say we're dealing with Lyme, and so then, especially if it's chronic Lyme, you don't necessarily want to wait until it comes up again in a scan because it may not come up for several months again. So you want to make a note, okay, that Lyme is an issue, and then you put it next time around into the search function, and you do a test single item, and you see if you should put it in a treatment anyway, even though it didn't come up in the scan. Because with chronic infections, you need to follow up. You can't just drop it like Epstein-Barr virus. You sometimes have to treat that for months and months. And you can't always just rely on it coming up in the scan. Once you know that that's an issue, you want to keep an eye on it and keep track of it.
Yeah. Dr. Straley?
Yeah, go ahead.
A couple of times I've tried to save some treatment baskets. I've been working with Dr. Flannery, and so let's say I run a mold and mildew panel, and then several items come in, and I create a basket for that, and then I hit save so that then I can come back and work on it another time after I've run it this day. I'll come back tomorrow and run it again. But maybe I'm not doing it right, because when I hit save, it calculates a time there in that lower right hand corner, but then when I go to click on it the next time, it's not always there. So I don't know if I'm doing it wrong.
Well, it'll be there. It depending on. So, for example, I'll show you in a second because we added vitamin B4. So I'm going to save it again, and then if we click the old one, it will be without the vitamin B4, and when we click the second one, it will be with the vitamin B4. And that seems to work. Okay. You just have to kind of keep track of it.
Yeah, I'm not sure why it wasn't working, because I'd go to click it, the basket would be empty, and I had 10 items in it, and I'm like, well, what happened? What did I do? Was I in the wrong box when I hit save, or?
Yeah, well, something like that. I mean, once you hit remove all, then of course it's empty. You have to make sure you're in under the same person and all that,
Yes. I'll double check it, and if I keep having issues, I'll submit a ticket.
Yeah. So if you come in under a new date, no, I mean, these dates should be here. You know, all the dates that you saved something should be lining up here. All right, so so there you go. Okay, Pamela, so this is not the end of all, but this is one important treatment. I advise you personally, keep an eye on that surgical steel. That may be,
I will.
you may have, your body may not like surgical steel, and so it generates inflammation, and you can't take it out. So the only thing you can do is desensitize yourself to that surgical steel, and it will work. It will work, and it will take that irritation out of that area, and hopefully. So how was the skin cancer? How was that diagnosed? Like what kind of skin cancer?
Just basal cell carcinoma. I went to the dermatologist. I had a pimple. It was right next to the scar. So when they went in to remove it, they went into my scar from the open heart.
Yeah, I treated a fellow once for surgical steel. He, whenever he had surgery, he was an athlete, and he had lots of surgery in his shoulders and stuff, and he was in excruciating pain after each surgery, much more than everybody else. And turns out he was just allergic, I don't know, the scalpel or something about this. It was surgical steel that gave him that extra problem. But, all right.
Well, it's interesting because when I had my open heart surgery, I found out I was allergic to the anesthesia. So I started having migraine headaches after that. So I had to have allergy elimination treatments for the anesthesia.
Yeah. So speaking of anesthesia, you know, it goes both ways. I've treated people for, of course, if they're allergic to any kind of anesthesia medication, but then also there's some people that it's the opposite. You know, they get 3 shots from the dentist of lidocaine, and they still have excruciating pain when he works on their tooth because they detox the lidocaine so fast that the dosage is never enough. And you can treat both. You can do this thinking and this method, you can treat both the hyper and the low detoxin. So
yeah, because I don't normally get anesthesia at the dentist because I'm so sick from it afterwards that I get crowns without any anesthesia.
Yeah, so someday this will come up in your thing here, in your scan result, and because there's several anesthesia products in here, and so then you treat it. So I'm going to say. I'm going to save this. Okay, so now we have 2 here, one at 426 and one at 345. So I'm going to remove these. Okay, and now the 345 was the first one. Oh, okay. I didn't save the first one. I saved that. Remember that? Okay, and then this is the one with the vitamin B4. So this confused me. I thought this was the earlier panel here, but it was actually the corona that we were playing around with earlier. Okay, all right, so that's the basic gist on these on this panel, the allergen profile. It's a workhorse. It's how you balance and harmonize the metabolism. And so think in layers: food, infections, toxins, you know, and such, inhalants, you know, as well as emotions. So there was not too many emotions here. Let's see what the first emotion is, by the way. So MMR, you know, it's not just a vaccine. It's mumps, measles, and rubella. So I had, for some reason, I don't know about where you guys are, but in this neck of the woods, in fact, it's everywhere. You know, these viruses are everywhere because we had some remote stuff going on, and this was in Florida. Oh no, was it you, Maggie? Did we do rubella with you? Did you have a rubella case?
Yes.
Oh, okay. We had all kinds of rubella in the last 2 weeks here, usually on adults, but kids also. For some reason, you know, rubella is going around. I have no idea. I had one yesterday, an older guy. He had a rash.
I never had the MMR shot. So does that make a difference?
So that's why I'm saying, don't look at this as just a vaccine. It represents, the viruses that are actually in that vaccine.
Yeah, because I haven't had any vaccines
So
except for
don't
the COVID.
vaccine, but actually as the virus.
Dr.
All right,
Straley?
well, no emotions, Pamela.
Does that mean I'm good?
So while we're at it, okay, one more thing on this panel. Go to the bottom as well. Remember, we always, the low ones are important too. Now, there's different things you would look for here. In fact, okay, let's go back. Okay, so what I would add, so what I'm looking for at the bottom, at the bottom there's nothing going on. There's no activity. It's kind of dead. So certain genes you don't want to be down there. For example, this is a good gene, FUT2. It's a longevity gene, has to do with vitamin B12 and fat digestion. It's a good gene. You want that gene to be a little bit more active, not hang out down here. And potentially this gene as well. But that's a little bit more advanced. And but start looking down here. Sometimes it's enzymes too. So let's see, certain enzymes. So for example, this is an important detoxification gene, that's one I would put in. So yeah, this is not a good enzyme to use as an example. That's more of a marker. All right, well, no enzymes. Okay, so anyway.
Dr. Straley?
These EZ things, EZ45 are usually enzymes, except in this body, it's a marker for actually a disease process.
Before I get any further into the project I'm working on, I had a question. You know how you have each one of the items within the different panels that have the descriptions? Do you have a dictionary set up for the IMAET or a...
No,
because I'm trying to learn all of the stuff, and so I'm creating my own database just so I can quickly look at something and understand what it is without having to go into the panel. So based on my history and physical with a person, I can have that knowledge. Do you already have something like that created or no?
No. I mean, it's
Okay.
usually right here on the software. Like these genes.
Yeah, No, I'm would be using it for I'm a read, write, recite, learn kind of person. So okay,
Yeah.
I'll keep going on the project.
Well, let's say you don't know what FUT2 is, or there's some genes that don't have an explanation yet. They come with the next. So don't hesitate to go to Google and just bring it in and type in FUT2. You don't even have to do gene, but of course Google knows that I'm Googling genes constantly. So okay, and there's all kinds of sources that will explain to you what FUT2 is. So okay, in all kinds of details. So anyway, yeah, it's a good resource in that way. So that's the Allergen Panel, a very powerful panel. And don't forget this basic one. It's okay to start out with the basic one.
Dr. Straley, oops, sorry. I was just wondering if you could remind me what the search is for if you're treating somebody for toe fungus. I think one of them was toe mix. I think there were two.
Mm-hmm. Well, so I mean, of course, you could find it under fungus, but there's so many different fungi in there,
Right.
Somewhere there will be the toe fungus, but there's probably close to 100 different fungus, so that's not very helpful. I mean, there is toe fungus in here, and like trichophyton is toe fungus. Nothing really.
Sorry, that was a pretty specific one.
Well, there's toe mix, which is fungus, yes. But if you don't know that, C. trichophyton, geotrichum, these are all fungus that are frequently in the nails and skin and so on.
Okay.
So yeah, you have to play around with that. We're cleaning things up all the time, so there's less confusion with searches. And like, I'm surprised that toe fungus did not brought up nothing. Fungus. Let me see about nail fungus, just for the heck of it. Nail fungus. Nothing. Okay. All right. All right, what else should we talk about? So there's, of course, there's 24 different panels there.
So I had a
The
question.
spinal.
What's that? Spinal?
Spinal?
Yeah, spinal is great.
Can I ask a basic question real quick before we get into it, just so I can understand, just something you already covered as we move forward? When we talked about calibrating the machine, if you're not using the harness, does it matter when you calibrate the machine if the harness is attached or not? Does that change anything?
No, I mean, if you're using the harness, you want everything to be set up by the time you hit the calibration button.
Okay.
Including the harness.
But if you're doing body biofield, just make sure the harness is disconnected from the back of the IMAET. And then
yes.
calibrate.
If you have the interface box or the harness system, and you want to do an assessment in Metaspace,
Yes.
in preparation for a treatment in Metaspace, yes, you should disconnect the harness, because it will be dangling around and it will gather aberrant information, and yes, you want to disconnect it.
And then if I'm doing Metaspace and I'm sitting within 6 feet of the client, does that interfere at all, or is there any distance I need to have or not? I just want to make sure I get the basics.
6 feet is a good distance. That should be a minimum. Whether it's you or whether it's a family member, should be away for 6 feet at least. The further away, the better.
Okay. So it doesn't pick up my biofield, it picks up.
You become part of the energy field.
Okay, thank you.
Yeah. Pamela?
Yes.
So
Yes.
how is your back?
I've had a lot of issues with it, so I was wondering if I really want to make sure I'm doing this right. So I was just wondering, can I do one every day, or is that necessary?
Oh yeah. I think in your case, I would probably go to neuroemotional panel. In other words, okay, let's do a quick thing, and then we'll where are we? Test potential. So the way you interpret the results in a spinal panel is, again, we're looking for highs and lows, okay? But the highs are kind of easier to rationalize, it's hot, it's inflamed, it's subluxated, it's while the low, how do you interpret the low numbers? So what's going on there? So the low numbers are more lack of motion, just stiffness, lack of circulation, lack of range of motion, it needs movement in there. And so Pamela is a good example. Her highest is 57. So we're more concerned about lack of circulation, lack of movement, lack of range of motion, and that type of thing, not frank inflammation. So we have lumbar 4 is a single digit, cranial is a single digit.
I did a cranial last night.
Cervical,
I can't believe it's still only 6.
Cervical is a cranial with the computer?
Yes.
So lots of single digits. So we can't assess them, we can't treat them all, but let's do just a couple in closing here. So cranial and cervical 3, they're very close together, right? So there you go. You want to treat yourself frequently, and you will see these numbers change. What was the highest number yesterday?
I
You
don't remember, but it was bright red.
Well, yeah, the color is always going to be red, even if it's like 57, which is not bad.
Okay, I wasn't paying much attention to the numbers. I was looking at the colors.
Yeah, well, the colors only tell you that it's the highest in the scan result, but then, 57 happened to be the highest, but it's not high. It's actually very close to being perfectly balanced, but these are extremely low. So in 1 minute, it went to 100% just like that.
Nice.
Yeah, that was quick. Huh. Wow. All right, so that wasn't that big a deal. So let's do another 4. Yeah, so that's how the chakra panel is the same thing. You want to do the highs and the lows, always, no matter, yeah. Now there is some exceptions, like if there's a super low virus. In fact, I forgot to point that out. I mean, when we were in the allergen panel, that's where you want to have all the viruses and bacteria at the bottom. That's a good sign, and you want to have the genes at the top. In fact, if you scan a really healthy individual, you can see that. I mean, it's predominantly, there's lots of genes in the top window of 20 items, that's a well-functioning body. The genes are happening, they're working. And all the nasty viruses and things are at the bottom because they're still in the database, but there's no resonant signal coming out because they're not present. Okay, so the cervical seems to be.
So was I kind of in the middle?
Say what? Say that
So
again?
was I kind of in the middle? Was
Yeah.
I kind of in the middle?
With what?
What you said about having all the viruses and stuff on the bottom.
Well, no, there weren't too many genes at the top at all. I don't remember exactly. But you had quite a few infections at the top. So.
Okay, so I have a lot of work to do.
Yep. Well, we all do. It takes a lot of work. But the results are nice. I mean, you don't want to be sick. It's not a good state to be in. These days,
I'm like never sick.
These days, that would give me anxiety if
So because it says it's only 9% rectified, does that mean I need to keep doing it till it gets higher?
Yeah. Why don't you do a treatment on yourself? You certainly can come back to that panel. And you may want to look at the neuroemotional side of things too. So maybe does somebody else want to volunteer? And we'll do another session a little different.
Sure, you can do me, Dr. Straley.
Who is this?
Candace.
Oh, okay. Yeah. Okay. You sure?
Yeah, go ahead.
You won't be able to keep any secrets,
I know. Dr. Flannery's put me on a few of her things as examples, so I'm getting used to it.
Sharing your most personal stuff with a group of people. All right, 66. All right, Pamela, thank you for doing this for us. So
thank you for using me. I didn't mind being a guinea pig. That was nice.
Yeah. All right. So now the question is.
And Dr. Straley, in the next update, is it going to fix the issue with having to completely log all the way out of the system between clients, or will we still need to do that?
Well, we are actually working on that. I don't know if there's going to be a lot of changes in the next.
Okay.
In the next couple of upgrades, major changes. All right, next person. I mean, that's the best way to learn it is just to do, do you have the name right?
Let me see. It's hard. Yes.
You're in San Antonio, aren't you?
Helotes.
Oh.
Yeah. HELOTES.
Hello, dudes. So did it warm up a little bit in Texas, or is it still freezing
Oh
cold?
yeah, no, it's warm. It never gets cold here compared to where you're at.
Yeah, yeah, we had well, it's snowing right now. Okay, what's your birthday?
6/29/75.
Okay, okay, save all. There we go. Next step, lifestyle, meaning calibration. So one thing the new upgrade will have, for example, you won't have to come here. You just click on what now is called lifestyle. It will be called calibration, and it will do the calibration and jump you right to the navigation page once it's done. I've got the I've got to upload the Omicron. Oh, the Delta is not on there yet either. I've had the Delta frequency available for a while, but it will be on the upgrade the end of February, in March. Okay, and we're going to get better at that, more responsive. Like, basically Delta is sort of over, right? But it's not. It's not over. Okay,
I was going to say, it is definitely not over. The variants are more deadly than the Omicron. I know someone who works at the hospital said those are the ones that are coming in. It's the Delta that's killing people.
Delta is nasty. I had it. It's wow. It kicks you in the groin. Wow. So okay, Candace, what should we do? So we're going to do the Allergen Panel. Like the way I do it. Should we balance chakras or?
Sure. I've had a traumatic brain injury, had a heart attack, and I'm exercising, so I've got crazy muscle inflammation. So you pick what you want to work on.
Oh boy. What you've had a heart attack and what? A stroke?
A traumatic brain injury.
What kind of a brain injury?
Traumatic brain injury.
Oh, traumatic. Yeah. Let's work on your brain a little bit. Let's balance the hemispheres.
Okay.
Just in preparation for a treatment, even though this stands on its own alone, you can, but we'll bring your brain on board. In the additional feedbacks, that would be the hypothalamus frequency, even so there's detailed brain frequencies in that too, it's called, well, there's brain 1, 2, 3, 4, 5, 6, and then there's all the temporal lobe. All right, so your lobes are not particularly well connected, so let's connect them. Some people call that closing the curtains. So that's the nice thing about the IMAET, you measure something and then you fix it right away, and then you move on and you measure something else and you fix that. And so the right temporal lobe kind of had the hardest time. All right, let's do brainwaves. So how do you sleep?
It's fine now. I'm on homocysteine, TLR, and GABA, so now I sleep much better.
Really?
Mm-hmm.
TLR. What's TLR?
It's called homocysteine TLR. It's to help with serotonin conversion. And then GABA for melatonin and serotonin. I was having issues with sleep, and Dr. Flannery put me on that, and ever since I've been actually able to sleep through the night, which is so nice.
Okay, so your beta waves are the highest, which makes sense because right now you're paying attention, and so that's all good. So let's see what the alpha waves are. 51. You see, 51, and the theta waves are 31, and the delta are 54. So maybe we'll do the lowest. 31, 51. 77. I think your alert state is pretty good, isn't it?
Yes.
Yeah. So let's do the lowest one, theta, the theta waves. Let's just do 1 minute at a time. So you use your best judgment, you look at the results and then you think about the person in front of you and So I happen to go with the lowest number. Now, sometimes it's obvious you have to do the highest number, but it didn't make any sense right now to do beta waves because we want them to be high. So we could have driven them even higher. Like if you had an exam right now and you had another 2 hours to go, maybe we would have actually done beta waves, you know? Or if it was a little later in the day and you'd be going to sleep pretty soon, we could have done delta waves. But I think this is going to be most beneficial, you know, in my long distance assessment here. So anyway, all this now with autistic kids, you know, this is very valuable. This is very valuable. If you have any autistic, you know, individuals anywhere in your family or as clients, and by the way, it's the theta waves, well, any alpha waves that most of the time calm them down. I don't remember now on top of my head. We've had some profound experiences, long distance, you know, with calming down autistic kids when they're like crazy, banging their heads against the wall and stuff. It's one of those two, it's these two frequencies that will calm them down. So by the way, all these panels, these other panels have a biospecific stress database, you know, the ear and eye and the sinuses and the digestive system and the lymph system and so on. And so biospecific is kind of, you know, conditions or diseases and things. And then anatomical is just that, anatomical locations. That's not letting me switch while this goes on. Okay. All right, 83. So that's good. Okay, and then there's anatomical places. So you can go to different places in the brain. Okay, like there's the hypothalamus again, and there's the frontal lobe. So the beauty about this is that you can get anywhere in the body. You can get energy, vector energy anywhere in the body. And remember, you can also always combine it. So this is not a good example, but let's say you have an infection in the occipital lobe, right? Which doesn't make any sense even. So it's possible, but especially like in the ear. Well, let's just go there. Okay, hold on a second. Might as well. Okay. So by the way, if you want to get to these panels right now, you still have to go through the lymph window to get to, let's say, the ears and eyes. Okay. So then the ears and eyes, and let's say you want to get to, like, I like to talk about the eustachian tube, but anywhere. Okay. Because people do have infections in the eustachian tube, viral and bacterial. And so you can combine do the eustachian tube and then go to the allergen profile and do the virus. What I do, I actually will, that's one advantage of having the professional system is you can download the frequency into a medium like a vial or a dropper bottle or something. And then the person can hold that frequency and you do the eustachian tube through the computer. So you have two sources of information, you know, the virus and vector to the eustachian tube or some anatomical place.
I've been using this one for, I have Fuchs dystrophy, so I go to the eye panel and work on that.
Awesome. Well, you have a great mentor there in San Antonio.
Yes.
Yeah. All right. So now we've got your brain somewhat primed to the advantage of the. So with the full system, you know, there's all kinds of things you can do as well. But the virtuoso is, you know, you don't have to deal with all these wires and things. All right. Well, let's do the same thing if you don't mind. Okay. We'll do the comprehensive test. The basic test is pretty simple.
So how does the virtuoso vary? Like I wasn't quite aware of the options, so I'm just curious. I don't really know anything about the virtuoso or the difference between the two. So did you want to maybe just say a little bit more about that? You said you don't have to use the wires.
Right, right. So
Is that different?
This is wired up with the professional system, right? There's some advantages in the sense that you can make remedies and you can import frequencies that are specific or special that only you have access to, that may not be in the software, and little things like that. But for everything else, you can, it's if you have a practice and you have lots of people that come to your office, the professional system is nice. Otherwise the virtuoso is just as effective.
And on the Virtuoso, I have a hard time when I touch the screen, it doesn't respond when I'm trying to set the time or put in birth dates or anything. Is there like a stylus available or anything?
Oh, well, I don't know. Which computer do you have?
Oh, the one, let's see, it is the Microsoft Surface Pro 8.
Oh, as a matter of fact, there's a stylus. I think it's some $90, $79 or something. If you go to Amazon, you can order one.
Okay, great.
Yeah.
I think I'll do that because I spend half my time just hitting it and it won't respond.
Oh, really? Huh.
Yeah, I think it's my own body chemistry.
Yeah, there's a stylus available. So this one is got the harness, the head harness around the trunk. So anyway, you can be very creative with energy. There's certain principles you can't violate, but outside of that, energy can be combined in all different kinds of ways.
Can I ask you, Dr. Straley, when you were talking about not wanting to overwhelm the body and not trying to hit too many things, like when I'm usually treating somebody, I will start with the brain and close the curtains and then maybe move to the lymph system and stimulate their lymph system. And then, is it okay, like if you go into their allergens and do some of that and check their spine, and check their meridians, or is that doing too much? Because I'm doing family members, so I'm spending a lot of time. I'm not like, oh, I have, a half hour to treat you.
Right. No, it's not too much. As long as what you don't want to do is run this panel and then go, like you were saying, go to the main reactivity test and then double check this over there and run it again over there. You kind of don't want to do that. You make a decision in the beginning, either you're going to work off of this one, and then tomorrow you may want to work off of the other one. But you don't want to combine it on the same day. So we ran over 2,500 different frequencies on Candace. Okay, 2,500 some impulses went in her body, and then we measured the returning frequency coming out. So that's not entirely benign, it's fine, but you don't want to, next thing to do, put in another 7,000 impulses. And first of all, it doesn't make any sense. And secondly, you have to be gentle with the body. It's you don't want to make things worse or overwhelm it. However, some of these other panels, they're kind of supportive, the Meridian panel, the chakras, the brain balancing, even the hormone balancing, and all those. So unless you have, these are basic food items. Those real low numbers, like they're in the ID number is really low, means they're in the basic 40. They're called in the show method. By the way, I'm teaching, I committed to teaching a show method seminar on April 3 and 4 or something in San Antonio. So
Oh, perfect.
unless, Candace, unless you are taking vitamin A supplements or something, I consider this an allergy. Okay, so I would put that food component in there for sure. Vitamin A is very important. So this BRCA2 is an important gene, repair gene, that's been made famous by, if you have a mutation in it, it causes breast cancer. So that shows up here at the top, that's good news. You just take note of that, that's you like that, you want that. If that gene would be at the bottom, you would definitely want to put it in a treatment. Okay, I do that every day. I find them down here. I put them because I want that gene to be busy to keep that DNA clean, so we don't develop pathologies.
Okay.
So we're looking for food. Okay, vitamin A. So now we have pecan. So those are nuts. And then dust would be an airborne component, and feathers are kind of important, but they're a contactant kind of. Okay, cephalosporium is a mold. So we'll stick with that. That's the food component. So now I don't know what to do with diesel. We'll just ignore. Whenever you don't understand something, just skip it. Don't spend a lot of time trying to figure something out that doesn't make a lot of sense. However, this makes a lot of sense. This bacteria, you want to put that in. Insect repellent, that would be a chemical or a toxin. I don't know if that's an issue. Are you using insect repellent or?
No,
Yeah. So pecan we'll do some other time. That's tree nuts. That's a tree
Yes.
nut. Dust could be, maybe we'll put the dust in there. So we have a food item, an airborne item, and an immune item. This parasite here is kind of not super. Oops, I jumped quite a bit. Hold on. I just look at a couple more, not too many. Here it goes again. Not very steady hand. So hepatitis E, where was it? There, that's a virus. But we're working on bacteria. Herpes simplex 1 is a virus. Candida. So there's some interesting stuff down here, but it's too far down. So right now, that's all we need. We've got a food component. We've got an airborne component. Because dust is all kinds of different dusts, all different kinds of materials are in dust, including calcium and things like that. And we have a bacteria. Now, if there was another bacteria, I would put it in, but there really isn't. Well, we would want to put these additional feedbacks in here. Remember, digestive acids, digestive enzymes, DNA, RNA. Hypothalamus is the nervous system, the autonomic nervous system, all the main organs, and the basic hormones. Let's save this, and we're ready to go. Quick cycle, remember, and we are addressing 3 layers: a food layer, an airborne layer, which are related, food and air, because whatever you breathe in, you have to process and digest. Just like if whether you put it in a spoon and in your mouth, or whether you breathe in through your nose and it comes down your throat, once it's in here, it has to be processed and digested and broken down and processed. And they're the same enzymes, whether it comes by spoon or by air. Breathing in 2,500 gallons of air in a 24-hour period, that's a lot of stuff that needs to be detoxified. And that means all kinds of things, including it actually needs to be removed, from the body. And so you have to process it through the inside and eliminate it, funnel it through the organs and everything. So we just went through the first round of those 3 layers, and now it's doing the combinations or the feedbacks.
So Dr. Straley, while hers is running, can I ask you a question?
Please.
So just like as an example, as I'm trying to learn this, I'm looking at, as you know, I just got the equipment. So I was just kind of playing with it with my husband over the weekend just to really understand, or just to try to see how the different panels work without really knowing what to do yet. So like, for example, when we ran his comprehensive allergen panel, ATP and an amino or an enzyme and like cat hair are at the bottom. And at the top is P53 gene and like some type of like a candida. So I think it would make sense to treat the candidas, but like the P53 gene, it's at the top. Do we want to leave that alone and treat like the ATP and the digestive enzyme that's at the bottom, or what? I just want to make sure I fully understand how to look at what's at the top and bottom correctly.
You're actually, your thought process is in the right direction. So that TP53 is a good gene, just like the BRCA2, and that it came up at the top. That's good. That's good. So it's not a priority. You could always push it a little higher, but it's not a priority unless you're worried specifically about cancer.
He's had his mother died from pancreatic cancer, so he treated for it, but now I'm like, did I need to or not? That was kind of the question. I wasn't real sure because, my question became, is that because of a genetic mutation, or is it, couldn't decipher whether that meant good or bad.
Well, it's always, genetic predisposition is part of it for sure. So, but that you notice the candida at the top, that's important. So that's something you want to put in a treatment to focus the immune system on getting rid of the fungus. And then you may also decide to give him or take some probiotics to, as the immune system kills the fungus, something else has to re-inoculate that area. So that's where the probiotics then come in and re-inoculate the gut wall with beneficial bacteria that actually help you absorb and the nutrients. Now, what else? What did you say about the bottom? So yes, so ATP is a unit of energy. Okay.
Yes, right.
Yeah.
And that was at the bottom.
So that's something that makes sense to upregulate. So you would want to put that in the treatment. And then this enzyme that you mentioned.
It was EZ15 amino peptidase.
Yeah, yeah. So those make sense to put in the treatment. So you're right on track with how to think through these results and put them in a effective treatment. Yeah.
Okay.
Congrats. You're off to a good start.
Okay, thank you.
Yeah.
Dr. Straley, as far as in order, the ones that come to the top versus the bottom, can you explain why, like, for instance, the red, yellow, green will pop up and the numbers when you do a testing item on them might be 50, 20, and 30. But I know because of my body, there's other elements. So I'll do a testing item on other things and they're in the 99 range. So I'll do a treatment basket on them. Is there a reason why those would not come up to the top, but those other red, yellow, greens come to the top, even though they're lower testing item numbers?
Well, see, the difference between the test single item and running 2,500 items is that you're comparing one item, you're just measuring one item all by itself, sort of in a sort of a vacuum. When you're checking for 2,500 items, the priority is a little different because it's compared to everything else that's going on. So it's not by itself. It's compared to 2,500 other things. So you get a little bit different information from the test single item, and then it becomes your decision on what you want to focus on. So I use the test single item, particularly for things that don't come up in the test, but I know that could potentially be a problem, you know, like a chronic Epstein-Barr virus or any kind of chronic infection that I know I want to be watching over time, make sure it's eliminated 100%. So as far as this result is concerned here, so for example, you know, you always want to kind of be flexible in your mind. And so I don't know if, now it could be the case that pecans are high in vitamin A, source of protein and unsaturated fats. Let's say this person says, well, you know, every time I eat pecans, I get a little numb around my lips or tip of my tongue or something like that. Then, of course, you would want to put that in the treatment, right? I'm thinking basics right now, and so you know, we decided to do the vitamin A complex, which is vitamin A in many different foods, But you always want to try to put things into context with the person that you're working on. All right. So, oh yeah, and if you want to save the scan itself, you got to save here. That's the scan result. What we saved here is just a treatment. Yeah. And by the way, you can't save. You can only save the comprehensive one. Okay, very important panel. But there is other panels. So on Candace, we did allergens, and we did, what did we do? Oh, brain. Okay. So, one panel this is a great panel. And, you can do lymph stimulation. And you want to do a minute's worth of lymph stimulation, Candace?
Yes. Sure. I use it every day before I do anything else. I do the 4-corner method. I go to the lymph and then the meridians and chakras. So I do the 4-corner method and then I hit allergens just so that my system is up and running and ready.
Yeah. So there's all different kinds of ways, to go about it. The 4-corner system, that's a thing that Dr. Flannery came up with and teaches. And so there's so many different ways of approaching the body, That's the beauty about it. Well, does anyone have a particular health concern that we could maybe we could try to quickly figure out through a scan? Anybody wants to volunteer?
I do, Dr. Straley. This is Kathy.
So, okay, so it shows, 1 minute, 66%, that's pretty good. Well, can you tell us a little bit, give us some ideas?
I would love some insight on treating tinnitus.
Well, so tinnitus is complex because there's so many different reasons why.
Right.
So let's see if I had, like, if you were in my office, and of course we would just get started with the basics. And what's your birthday?
5967.
So you always start with a calibration. Okay, tinnitus. Well, I mean, there's several tinnitus frequencies in the software. Have you found some of them?
I believe I have. I mean, I've poked around different panels, and I've certainly worked on ears. And then I've gone into the Allergen panel and typed in like the different nerves, like auditory nerve or cochlear nerve, and ran, tested both the nerves and treated those.
You ever notice any change?
Certainly not immediately. I mean, I sometimes, like, I think I did treat like yesterday or the day before the nerves. Today, I was actually feeling something going on with my right ear. Not like a decrease in the ringing, but I felt something going on there. Like, actually, it was like more like kind of an achiness or pain, like in the right side of my jaw near the ear.
So the frequency for tinnitus you find under biospecific,
Yeah.
I don't do that too much because I just rarely treat pathology anyway. So my instincts drive me to this panel because I would, so there's different possibilities. It could be nerve damage, but you know what? It's rarely nerve damage. It's rarely nerve damage. You know, there's certain people like military veterans, you know, that had like explosions and their ears were blown out. And I mean, you know, and some people that were hanging out in front of big speakers at big concerts and got their brains rattled. But for the most part, it's usually more due to, the most common thing is probably congestion. Congestion somewhere in the ear, you know, there's a lot of canals and things in the ear, and it's easy for them to get filled up or be a problem. So what I do, I always look for infections. They're responsible for a lot of inflammation, and of course allergies. Now that's, you know, I mean, you know, from little kids they have, you know, ear infections, right? Well, the vast majority of ear infections in little kids are due to allergies. So you take care of the allergies, and then where there's allergies, there's infections, goes kind of hand in hand. And once you clear up those two items, you know, a lot of tinnitus will improve, sometimes go away. The older you get, the more difficult it gets. Like anything else, it's probably because of the, you know, the sustained damage. You know, if you have inflammation in your inner ear for 40 years, it's going to damage the cilia in there and so on, and affect your hearing. It's a scary thought because it's very uncomfortable. It's very uncomfortable. Buzzing in the ear and noises, and it can drive you. It drives people to suicide. It gets so bad. So again, it's just like arthritis. You know, the plan or the strategy is to prevent that serious damage from long-term exposure to the inflammatory triggers. So we're having a show method seminar here in Syracuse, February 5 and 6. So if you're into cross-country skiing, come on up. No, we've got, you know, the best ale in the world. So the show method is here's the basic thing, and you should all have that. I mean, I'll send it to you whether you're coming to a seminar or not. Just let me know if you don't have it. So I would keep track of what you have treated, because you should treat all of those, including for tinnitus, eventually. Now this, you know, this may take the better part of a year, and the scan result will kind of guide you. You know, these things will come up. Like we just had with Candace, we had vitamin A, which is number 15 in the show method. Okay, so it doesn't always go 1, 2, 3, 4. It jumps around because of just individualities. But all these are essential nutrients so everything functions, just the basics, whether it's detoxification genes or whether it's neurology or everything. And this is embedded in the thing that we're just testing now. I mean, that's in fact in the upgrade that's coming out now in the beginning of March. It will have this sorted out in this new order. Okay, so let's see. There you go. Histamine. All right, let's get rid of this. So yeah, histamine is high. Okay, so you can't treat that. Like, I wouldn't put that into the treatment, because what are we telling the body to do? I look at this as a biomarker. In fact, I've got one of the next Gold Club things are about certain things that you have to look at as a biomarker. It's something important to realize that it's going on, because so now we're going to be looking for antihistamine genes. Now, if we could find down here antihistamine gene, which of course, it's, you know, sometimes that happens. I don't expect that to happen today. That will be just too beautiful. But, you know, I would put that gene in. Since we're at the bottom, the Parkinson's gene always, you know, that's a dopamine gene. It just was discovered in. Now, here is an emotion I always put in that comes up at the bottom, and that's global success formula, which this is a frequency from NAET, and it just means addresses personal, emotional, professional, and social economic success. Okay, so success all around. I always like to upregulate that if it's down here. So unfortunately, we can't find any. Okay. In that case, what we'll do, since we're stubborn, you can't find it at the bottom. Excuse me. What I would want to do, so of course, histamine would point towards inflammation, and that could certainly be. So right now, I would say your tinnitus is due to you have high levels of histamine, and we need to break it down. So let's type in histamine, and hopefully the antihistamine genes will come up. There it is, DIO gene. So the DIO gene is your antihistamine gene. Okay, you want to upregulate that. And where's H, N, and T there? Those are two most important ones. Okay, for histamine. So now if you wanted to get more fancy than that, so those I don't even single test item. I mean, I don't, because I'm going to put them in no matter what. But these other ones, I'm not so sure. So those you could single test item, because I'm not. So 23, it's a little on the low side. It's a little on the low side. So well, let's put it in. Why not? Okay, I forget what this gene does. Protein coding gene. Let's see. Somehow it has to do with histamine. 33, yeah, not bad enough. The histamine receptors, 29, yeah. Mast cells, they carry histamine granules, but I don't know. There's another GABA gene. 99, ooh, okay, see, let's put that one in. Now, of course, mold exposure can, of course, trigger all that. Okay, so we've got a bunch of genes here. Maybe we'll take this one. That one wasn't that high. The GABA3 was really high. All right, and we clear this, and we'll go back to actually our scan results. So what else can we find? This thing up here, the histamine, made me aware of that histamine is a problem. So now I'm looking functionally, how can I improve that? Well, these are the genes that are going to work on that, plus some other ones that are, that were just at the bottom. Fabric softeners, that would be a chemical, which could be an issue.
Dr. Straley, were you looking for those genes to have a high number that you put in there? Sorry, I didn't get to see the numbers on those on my screen.
This one had a high number, the GABA B3 or GABA 8-3, B3. These I didn't even test, because I'm going to put them in no matter what, because they are antihistamine genes. One is more active in the body, the other one is more active at the brain level. So we're at the top. So, I don't like viruses. I always go after viruses. So this is an important gene. That's good that it's up here. This gene is up here, and that's all good. Acoustic nerve. Whoops. Let's put it in. Let's put it in. Acoustic nerve. Look at that. Huh. I
Actually worked at that. I did work the acoustic nerve a couple days ago, so interesting.
Well, maybe it's actually working a lot or good or well, and that's why it's there. But did you do it on this panel or on the ear panel?
I think I went into, I didn't do it in a treatment basket. I put it in the Allergen Panel and in the search bar, and then just ran a feedback on it just singly from there.
Yeah. Okay. So are you taking vitamin B12?
No.
No. All right. So that may be an issue. Okay. So if somebody just took a dose of vitamin B12 an hour ago or earlier, this may be an abundance of vitamin B12 that the software picked up. But if you have, then it's probably either a deficiency or an allergy. So a so-called, what I call an allergy, just a metabolic issue. So I would put that in. Okay, so we got vitamin B12. We've got, that's our food component. I wouldn't mind putting in a mold, but let's see, is there any other viruses? Simplex 2 is it, right? Any other viruses? Flu virus. Okay, let's put that in. Okay, so let's stick with the viruses. That's enough. MRSA, that's too far down to worry about right now. Okay, there you go. And so we had our thought process, right? Well, you let us know, Kathy. You know, it's not about, and we save that. And right now we'll do 2 minutes and see what happens. But anyway, that's kind of how you think through these results and put treatments together, and little by little they add up. You know, gives you a great little
Yeah,
tool.
and hopefully that thought process comes in time when you start treating more and more people.
So Kathy, have you ever taken an antihistamine, like an over-the-counter antihistamine, and kind of observed?
Probably in the past. I'm not really keen on taking any over-the-counter medications now, but
I would just, it would be interesting as a differential diagnosis to see if there may be a delay. So, you know, because the fluid would need to build down, you know, get reabsorbed. So it may not be as immediate as one would like. So, yeah. But it's worthwhile working on that. So remember those 2 genes, DAO and HNMT. Those are your main antihistamine genes.
I wrote all those down. Yep.
You may want to put them back in a treatment as you treat yourself.
Thank you.
Are you not hitting BBF for
Yeah,
a reason?
I literally, I just did it to save time. I wasn't sure that it was necessary. I should have, and I should have put hormones in too, but each of these takes 15 seconds. So, you know, like these 2, that's another half a minute. It's like, yeah, it's nice when you can treat yourself, because when you go to a doctor's office, it's all about time, you know, it's like boom, 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 you gotta, like, you know, the doctor has only so much time because you gotta see all these patients. And, yeah, okay. Any more questions?
Would you mind hitting the chakra or auras? Because I've looked at it, but I don't even know where to begin with it. I don't know if that would be beneficial. Is that something quick that we can look at, or?
Yeah, it's pretty quick. Who is this, Maggie?
Yes.
You do the same thing you do with all the other panels. It will mark the chakras with red, yellow, blue, and the lowest one with green. And then you just make the same kind of decisions. You know, if the red is 55, well, then probably the green is going to be super low, and you go for the lower ones.
Oh, do you test both the chakra and the color? I don't.
No, the color is just a mechanical marking of the scan result. If your highest number is 55, then the software will mark 55 with a red because it's the highest number. But clinically, it's not high. It's not high. You know, so you just basically you ignore that and you override that color combination.
There's just that one that's like a color profile.
It's a coding. It's a coding number. No, the highest number is red, the second highest number is yellow, and the third highest number is blue.
Are you talking about the auras?
Oh, maybe that's the auras. Okay.
Oh, well, the auras are different altogether. I don't think, can you treat the auras?
No, with the colors that she's talking about, is that in the aura panel?
Yeah.
The different auras or?
Yeah, we're redesigning the aura function in that panel, so it looks a little nicer. It's a little easier to interpret and to actually see. So I'm looking forward to that.
Okay.
But Maggie, so in the chakra panel, okay, I mean we can go there. Let me see. We're doing Kathy.
No, I get it. I see. You don't have to spend time on it. I see how
you do the same thing. You just run a scan. And then you got your numbering, never mind about the colors, but the numbers, and you go for the super high one and the super low one.
Okay.
And
Thank you.
It gives you a general idea about the status of the person. Now, I find a lot of exhaustion and lack of energy lately, like whether I do the the TCM panel or whether I do the Chakra Panel, it's always low energy. It seems to be predominant anyway. Doesn't mean that there's not high energy. Now, it didn't always used to be like that. But of course, I am particular, like, oh my God, I do a TCM panel, it's scary. I barely get the highest number up to 52. But yeah, it seems like people are energetically exhausted the last couple of years. Okay, so that was interesting, Kathy. That was interesting.
Thank you.
Yeah, keep that in back of your mind as far as your tinnitus is concerned, that you may be driven
Yes.
by histamine. Yeah.
Dr. Straley, I would love to see, I work with a lot of clients who have thyroid, just endocrine disorders, and, you know, I've had my bouts with those, so love helping people struggling in that area. I also have one client that does have hemochromatosis that I'm just about to start working with. So anything that you can show me along those lines where might be good places to start with endocrine, thyroid.
Well, with all of this, you have to start here. So, for example, with the thyroid, you know, you have to make sure the iodine metabolism works, for example, and hematomacrosis, you have to make sure, you know, iron works properly, and so on and so forth. So you always want to work with these basic things, which are, of course, represented here on these panels. You know,
Okay.
that's what they're right here. There's iron and so on and so forth. Now, there's a couple, you know, we cover that in our seminars, but for thyroid in particular, just keep an eye on Epstein-Barr virus. It's very, very common, especially if there's thyroid issues. You know, 9 out of 10 thyroid folks, whatever it is, whether it's Hashimoto's or it's just hypothyroid, or whenever the thyroid is in trouble, one way or another, chronic Epstein-Barr is always part of the equation.
So could I, like, personally, my doctor was going to put my doc was going to put me on thyroid medication a few years back, and I said I just wanted to focus on maximizing my thyroid function, and I've never gone on the medication. So are you saying I might test for Epstein-Barr even if I never had mono or anything like that? It could be that, if like we ran mine.
Well, I mean, it's not 100%. It's not 100%, but it's very common. So
Okay.
you just type in the search function and just test yourself for. So now you can use the test single item and stuff. You know, and just check it. You know,
Okay.
it may be an iodine problem, and then of course there's other things. You know, the glandular system works together. It's not just each gland for itself. They're very much work off of each other. It's a balancing act there.
But you would start in the allergen panel for myself or for my clients in that area versus going to the.
Absolutely.
I think I saw.
Absolutely. And
Okay.
and they will get better. It's guaranteed if you do that.
Okay.
Because if they had no problems in here, they wouldn't have thyroid issues.
And
Now,
when do you move over to the?
well, it's the Epstein-Barr virus, so keep that in mind.
Okay. And then when would you then move over to there's that, I guess, that endocrine panel I think I saw when I was looking through things recently. I don't remember exactly where.
You mean the hormone panel?
Yeah, that's what it is. Okay. So when would you go through the?
Anytime. So this is a panel that you don't necessarily have to do all by itself. You know, you could just do that, and but it's something that you can do in combination with an allergy treatment. Whether you do it before or after doesn't really matter all that much. You know, when you do physical exercise and strenuous physical things, you should do it before such a treatment.
Okay, that's good to know.
Yeah, and when you do energy balancing like we did, like this, whether it's this or, well, actually, then you want to do that before the treatment, because that will help the treatment to go less restricted and deeper. And okay, well, I'm glad you are interested. That makes me happy. So we'll do this again. And anyway, stay in touch. The Gold Club is a good place. Dr. Flannery will be talking about hormones in a couple weeks. Utilize that Facebook group that we have, the closed one where all the practitioners are. All right, bye for now.